What are risk factors for perinatal mood and anxiety disorders? One is a personal or family history of a mental health disorder. If your parent had bipolar disorder, genetically you may be predisposed to having postpartum bipolar disorder. Anxiety, if you yourself have experienced anxiety throughout your lifetime, again, pregnancy and the postpartum period or periods of vulnerability where this may be increased. Two, a difficult childbirth. If one expected a spontaneous, more holistic vaginal delivery and it ended with an emergency C-section, intrapartum hemorrhage, requirement of a blood transfusion, this brings on sadness, perhaps some guilt from having an unexpected, difficult, and complicated birth. Lack of support. If one goes home with this newborn infant that requires a lot of your time, a lot of your energy, and there's no one there to help you, this will bring upon exhaustion and again, one of these perinatal mood and anxiety disorders. Stressors. Who in life does not have any stressors? Whether it's financial, marital stresses, if you already have children at home, or in my case, experience that I had with my last child, rushing to another job, trying to sell a house, buy a house, moving out of state. So stressors, financial or marital, can certainly bring about perinatal mood and anxiety disorders. Breastfeeding issues. We advocate women to breastfeed, but not everybody has an easy experience. You may not have good production of your breast milk. And again, this might bring along sadness or disappointment or guilt. Mothers who have multiples, twins or triplets, that increases the demand, more sleep deprivation. So again, you're vulnerable to a perinatal mood and anxiety disorder. If your infant has to go to the NICU, the neonatal intensive care unit, because of a complicated birth, a low blood sugar, which is called hypoglycemia, the baby was born prematurely, or for growth problems such as intruding growth restriction, this is not what you expected. This can lead to another perinatal mood and anxiety disorder. Major recent life events. Again, as I mentioned, if one has to move, if you're changing jobs, you have a new baby, or recent loss of a family member, this all adds up to the vulnerability of a perinatal mood and anxiety disorder. Women with chronic medical disease, not only are you now being forced to take care of your diabetes or high blood pressure or your thyroid disorder, but you're also trying to take care of your infant who needs a lot of attention and nourishment from you. Again, this leaves you vulnerable to a perinatal mood and anxiety disorder. If this pregnancy was complicated, if the pregnancy involved a lot of infertility treatments, this is difficult on you, it's difficult on your partner, and again, makes one vulnerable to experiencing a perinatal mood and anxiety disorder. And finally, if you have an adverse pregnancy outcome, if you have a miscarriage, I've experienced a miscarriage and I already had 2 children, but I was very sad. If you have a stillbirth, unexpected stillbirth, that is very difficult on a mom and you need to seek help. Again, putting you at risk for a perinatal mood and anxiety disorder. So it's important that women recognize that maternal mental health and well-being is very important. If mom is not able to take care of herself, one's not going to be able to take care of their infant and not their family. So what is the first step? Awareness and acknowledgement. Don't suffer. Notice the signs, notice the symptoms. Let your family know that you need help. You're not a superwoman, and again, you're in a very vulnerable time period. Let your healthcare provider know that you need help. It doesn't necessarily mean that you have to be put on medications. You may need to have a support group. You may need to have someone at home helping you, like a family member or a doula. The next thing, self-care and adequate sleep. Self-care is super, super important. I've learned this through the years. Being a physician and being sleep deprived, I'm not at my best as a physician nor as a mother. So self-care is important. Sleep deprivation, as I mentioned in the postpartum period, can bring out disorders such as bipolar disorder that was unknown prior to the pregnancy. Sleep, self-care, just getting in the shower, getting some sleep, putting some healthy nourishment in your body will rejuvenate you and make you best. Rejuvenate you to be able to deal with the demands of a newborn infant, and you'll be at your best. So self-care and sleep. Also, other resources are perinatal support groups. Women supporting women. Women sharing their experiences. So look for perinatal support groups. Seek the help. Seek the support. You'll be happy that you did. Your family will love that you're taking care of yourself, and it will make you your best as a mom. Our American College of Obstetrics and Gynecology, known as ACOG, has emphasized the importance now of comprehensive postpartum care. We used to tell patients to come back to the OBGYN office in 6 weeks after the delivery. We realize now the vulnerability of women in the postpartum period for such things as the perinatal mood and anxiety disorders. If someone loses a baby, as we mentioned with stillbirth, or a complicated delivery involving an emergency C-section and hemorrhage, we're bringing you back to the office within 1 to 3 weeks. So not only our diabetics that need to have their blood sugar managed, not only our hypertensive patients that need to come back for blood pressure management, we are also acknowledging now that the maternal mental health and well-being is paramount to the patient, to her newborn infant, and to her family. Do not suffer. Seek help. And we are actually bringing you guys back into the office sooner to address these issues. Finally, one can go online. There are certain screening tools for perinatal mood and anxiety disorders. One such tool is the Edinburgh Postnatal Depression Scale. Another is Postpartum Depression Screening Scale. But essentially, one can just ask, am I sad? With a newborn baby, we should be happy. We should have a lot of joy with our new baby. But again, that's not the case, and we want you to be aware that you're in a vulnerable time. So questions to ask yourself: am I sad? Have I lost interest in life? Am I having awful thoughts or intrusive thoughts about things involving my baby? Again, that should be acknowledged, and you should tell your family members and seek out help with your healthcare provider. Again, maternal mental health and well-being is paramount to you, your newborn infant, and your family. Thank you.